Assalamu alaikum. Again with posterior fossa malformation. In fossa malformation, you have to think about three things. Chiari 1 malformation, Chiari 2 malformation, and Dandy Walker malformation. What is Chiari 1 malformation? There is downward displacement of cerebellar tonsil through foramen magnum. Downward displacement of cerebellar tonsil through foramen magnum. If there is downward displacement of two things, man, that means cerebellum and medulla. If downward displacement of these two things, that means cerebellum and medulla, in Chiari 1 there is downward displacement of cerebellar tonsil, but in Chiari 2 malformation there is downward displacement of cerebellar tonsil vermis, that means whole cerebellum and medulla through what foramen magnum. This is foramen magnum. There is herniation of this true structure. This is known as Chiari 2 malformation. If two structure comes through foramen magnum, there is Chiari 2 malformation. And Chiari 1 malformation is asymptomatic, manifest at adulthood with headache and some sort of cerebellar symptom, like if we do the cerebellar test like finger nose testing, dysdiadochokinesia, pendular jerk, and Hilshin test, these type of tests, and if we do try to see the gait, uh, you will get the features of cerebellar symptom. It is associated with syringomyelia, spinal cord cavitation, syringomyelia. Chiari 1, syringomyelia. Chiari 2, in Chiari 2, that is non-communicating hydrocephalus is found more severe than Chiari 1, and it comes with dysphagia, difficulty in swallowing, a stridor, then apnea, cessation of breathing, and there may be limb weakness associated with myelomeningocele, associated with myelomeningocele. In Chiari 1 association is syringomyelia, Chiari 2 association with myelomeningocele, and finally the Dandy Walker, there is agenesis of the in Dandy Walker, there is agenesis of the cerebellar vermis, so there is cystic enlargement of the fourth ventricle. There is cystic enlargement of the fourth ventricle that fills the enlarged posterior fossa. It is associated with non-communicating hydrocephalus and spina bifida. Now, the syringomyelia. Syrinx is a $5 word for fluid. Syrinx contains only fluid. It's a fluid filled glial tissue line cavity within the spinal cord. Fluid filled glial line cavity within the spinal cord. This is syringomyelia. Fibers crossing the anterior white commissure. Fibers crossing the anterior white commissure that are typically damaged. So there is cape-like distribution, there is loss of pain temperature, there is these area anterior commissure, these area is lost, anterior white commissure compressed by these serines. So the loss of pain and temperature, at affected dermatome C5 to T4, C5 to T4 dermatome, and as lesion expands there may be damage of the anterior horn cell, which may cause lower motor neuron type of defect, Most lesions occur between C2 to T9, C2 to T9, usually associated with Chiari 1 malformation. Syringomyelia is associated with Chiari 1 malformation, less commonly associated with malformation, infections, and tumor and trauma. And that is all about posterior fossa malformation along with Syringomyelia. Hope you enjoyed.